Cronin Toyota and Cronin Nissan are honored to partner with Proudly We Served, as well as the continued support of our local active and retired military veterans across eastern Indiana.
I'm Al Bledsoe, Veterans of Foreign War, Post 1108.
And I'm Ron Chappell, chaplain for Vietnam Veterans Chapter 777 here in the beautiful city of Richmond. And our guest this morning is Brian
Benedict. Yes,
Benedict.
Thank you.
Right, absolutely. And I met this young man while I was engaged in some personal pursuits for information for my wife and I. So I'm glad that he could be able to make it this morning. It's kind of a unique position. I've not met anyone in a position like that, you know. And
kind of explain that. Have him explain that a little bit.
Yeah, yeah.
So I can
just the position.
get the drift of what.
Yeah.
Sure. So I'm part. Well, let me kind of go through some history here myself, just real quick. So,
sure.
You know, I was in the Army, twin brother. We both left on a Sunday, and right after graduation.
Oh, wow.
I stayed in 6 years. He retired as an intel major, retired at 41, and he works for the government today. And but when I got out of the service, I got my life and health license. And a few years after that, I joined the Richmond Fire Department, and I retired back in 2016 from the Richmond Fire Department. But the whole time I was on, I did insurance for police officers and firefighters through a fraternal organization. So instead of doing roofs and mowing lawns, that's what I did on my days off. So, you know, fast forward to right now, the whole Medicare, I work for a national Medicare, it's a field management organization. So our main focus is it's national. We have regional managers like myself. I handle Indiana, Ohio, and parts of Michigan. And I train agents and try to train them on Medicare properly, okay, so they can relay it to the folks out there. And I also, you know, my office actually is out of the Townsend Center there, but you know, and I help a lot of individuals as well. But the reality is we just, you know, as veterans, you know, from my father to grandfather to uncles. Both my brother and I's daughter was in the service, and my daughter's still in.
Right.
And so, but what we find is we just we don't understand how a VA and how TRICARE for Life work with Medicare.
Man, that was my confusion, I'll tell you. And I still don't understand it all.
Right.
And it just so happened that a friend of ours told us about you and where you were, but I'm retired Army, and my wife, she's on TRICARE Plus now, and I didn't understand that, plus, minus, divided, or whatever it was.
Yeah.
And so we made an appointment to go down and talk to Brian, and that's how we found out about him.
So is it important for veterans to have Medicare? Like before we got started today, I was telling you I have Medicare A and B,
right,
but I also have VA, because some hospitals are a little reluctant to take veterans, but they'll take the Medicare. They'll jump at that, but they don't want to. When you tell them you're a veteran, and I usually am pretty vocal about that, that they should use that first, and that seems to work pretty good for me.
Right.
Although I think I did have to use Medicare one time.
Well, you know,
it comes from the. Don't it come from the same pocket, or am I just?
It's a confusing.
Yeah,
it's many pockets.
That's pretty deep, and we need to get.
Yeah. So really, the bottom line is kind of go back to your Medicare A and B.
Yeah.
So the first thing that even I was unsure of for many years until I got into this, that, you know, someone when they retire, like my brother, he's on TRICARE, but he's not 65 yet. Okay. So when he turns 65, he required to get original Medicare A and B in order to continue, and it changed to TRICARE for life. It's a requirement. Okay? Many people don't realize that. With VA, it's not a requirement. Because that's a healthcare system itself. Okay? It's good that you have both, and it gives you the ability to see outside, physicians, but you don't have to have it. And that's what we find a lot of times with folks that use VA. First of all, it's a tiered system, and it's service-related medical. So, there's many people that get everything they need from the VA, but there's probably 75% that don't. Okay? And from dental to hearing to, and so just understanding that, hey, if I'm 65, I use VA on a regular basis, and I have an A and B card, it gives you the ability to choose a veteran-specific. They've made these advantage plans. They've made certain plans specific for veterans. Okay, and you're able to get that with. It doesn't affect VA benefits. It doesn't affect TRICARE for life benefits.
That's the frightening thing right there. You're worried it's going to
exactly. Yeah. And so that question always comes up: will it affect my benefits? And it doesn't. You just need to know VA doesn't take your A and B card. Okay? If they do, it's going to be a unique situation. Okay? It's just like a Medicare Advantage. So I'll give you an example here, is that, and he won't mind me using this, but my father is a perfect example of someone that uses VA on a regular basis for years. Gets hearing aids, glasses, everything. Okay? He's one of those top 25% that we were just talking about. When they turned 65, they were put on a Medicare supplement plan, him and mom. He paid that supplement plan for close to 15 years. All right? That's duplicating services. He should never have been on that plan. Okay? If you don't do a Medicare Advantage, you have to take a recertification every year to do this. And then that's what we train agents on, is how things relate to certain categories like VA, okay, and TRICARE. So I've found many people that are paying a lot of money. By the time you hit about 80, these Medicare supplements are $500 and they don't even use them. Okay? And so a Medicare Advantage plan, the great way to think about an Advantage plan is, and Ron, you probably heard me say this the other day, was that, if I lay down my, say a group health insurance plan, when you sign up every year, okay? You lay that on the table, you lay an Advantage plan on the table, I guarantee you would not be able to tell the difference between those plans, okay? The only difference is an Advantage plan is for individuals, not families, okay? And a lot of times the monthly amount is so much less. It could be as down as $0 a month. So, but how it relates to VA. So you would use VA like you do today, but why would you need it? And I think that's one of the biggest questions, is why would somebody even need it if you have all you need with the VA? And so, and on the back page there, you'll see some of those reasons, but it's, first of all, for zero, most of the time, it's $0 a month, okay? But many plans give you a Part B give back on some of those plans, okay? It could be up to $100. Remember, you're not paying anything for this Advantage plan, and it's for veterans. And so $174 that you're paying for Part B this year, $100 knocked off of that every month. Okay, it gives you the ability to get a second opinion in an outside source. So over-the-counter cards, a lot of those come with over-the-counter cards, so you can get vitamins and cold medicine, things like that. But a lot of it gives you dental, vision, and hearing. Okay, it gives you the ability to go get glasses, because some people can't do that through the VA. They can't get dental through the VA. They have to pay a certain amount for that if they want to get it. But everybody's situation is so different. You know, you have to talk to people individually. The one thing that I really say too is, like Al, when you have A and B, you're in a little bit different position than Ron, because he has TRICARE for Life.
TRICARE, right?
Okay.
Yeah.
And TRICARE for Life is very similar to a supplement. Okay. Because it doesn't come with dental, vision, hearing.
No.
It comes with prescription drug plan.
Yes.
And the fortunate thing that Ron's in is the prescription drug plan that comes with Ron's TRICARE for Life does not have a donut hole. And that donut hole for prescriptions, I can explain that in another series, but it doesn't have that. So, but for yourself, they have, you know, there's many plans out there that have a prescription plan or without one. It just depends on your situation. You know, some people don't like the mail order.
Should a person use the Medicare A and B and get into the higher advantage, or should he stay with the VA? What's the deal there?
Well, I think it's two separate things.
Okay.
Okay. So, you know, all three of the things that we're mentioning here is separate. TRICARE has nothing to do with VA. VA has nothing to do with TRICARE.
Yeah, okay.
You know what? That's what's crazy. People don't realize that. You know, you could be on TRICARE for Life and not even be eligible for VA. It's a crazy thing. You know, you wouldn't think that, but they don't communicate. All right. He doesn't show his TRICARE for Life card at VA. All right. It's a completely separate entity. All right. It's unique.
Wow.
It's unique. I don't understand it. I just know how that operates there. But
I had a situation. It actually happened about 6 months ago, but it finally just caught up with me about a month ago, where one of the people that the VA had sent me to through community care, they had sent me to this particular doctor in Kettering. Medicare called me and wanted to know why this doctor was billing Medicare. And I said, well, I don't know. They're not supposed to. They're supposed to bill the VA through community care. And so as it turned out, when I called the doctor's office, they said they was in the process of correcting that error, that they made a mistake. And I don't know what the line is with all of that stuff, but for some reason they had billed Medicare A and B or whatever it is instead of the VA. Because the VA, the people don't like the VA. It's, by the way I've looked at it, they don't like it because the VA's kind of a chop block. If you charge $50, the VA cuts you to $35. And that's kind of why some people don't like to deal with, because I've seen some of those billings from community care at what they start out at and what they end up at. So somebody out there is chopping that price down or something.
Well, you know, and I put it on there that you know, all you have to do is go to, there's three places that you can see where you can go to and see how these things relate to Medicare.
Yeah.
Okay. And one of those is, of course, the Medicare and You book that the government sends you that looks like a Bible for Medicare.
Yeah, okay. Yeah.
You can see TRICARE in there, you can see VA, you can see how it relates, and then if you need more confirmation than that, you know, you go to TRICARE for Life and print out their booklet, and you go to, you know what, page 5 to 13, and it shows you everything you need to know about how it relates to TRICARE. On the website for VA, you go to VA website, you put in the search engine Medicare, show you everything you need to know about Medicare and how it relates to it. And so the thing is with A and B, so here's a tidbit for even those out there that don't have VA, don't have TRICARE. The number one reason why someone at 65 gets A and B, okay, you have to get A and B, because if you don't, down the road, if you decide to, you're going to be penalized for that.
Yeah, okay.
There's 3 penalties in Medicare, and it's not getting A or B on time, and it's not getting Part D prescription drug on time. Okay? No one knows that. But the reason that if you know, you have a safe haven with VA, okay? But A and B alone by itself, and there's many Americans out there that have just A and B because there's so much noise. They get telemarketers, mailers, it's absolutely absurd.
Yeah.
Yes.
But the number one reason why you choose, after you have A and B, why you choose a supplement or why you choose an Advantage plan is because A and B does not have a maximum out-of-pocket limit each year. They don't have an annual cap, okay? And so if you say you wanted a second opinion, because whoever VA is sending you to may not be the top guy that you want to go for a knee surgery or for a heart surgery. You want to go to the top guy. That's where this comes into play. But if you just have A and B, you're going to go over there. You know, there's some higher deductibles and 80-20 stuff or whatever. But the reality is, there's no cap to what you can spend, what you're going to be billed for a year. There's no cap, okay? And so, like, with, say, some group plans, probably TRICARE, I'm pretty sure, they have a cap on the amount, the worst case health year that you would ever pay. And a lot of times, Advantage plans are only, I mean, there's some that's as low as $3,900 a year. And other, you know, I've seen some down at like $2,400 a year. That would be the maximum. But see, there's, you know, A and B, there's no maximum. There's people that are paying loans, they're paying on loans from just having A and B by itself. And that's what's kind of scary. So
I've been, the last 2 years, my health has kind of went downhill quite a bit. So I've had some pretty odd circumstances come up, and it seemed like this last episode I had, and one office wanted to just do something I just didn't want to do, and so it ended up, it went to the head lady that handled vascular surgery for the VA, and she looked at it and she said, you need to go to Indianapolis, and here's who you need to go see, and I'll put a consult in to see that happens. Maybe it's just been my luck or whatever, but I've been to some pretty good doctors, I feel like, and I haven't paid anything. And I just keep wondering when I'm going to get, I'm going to get. As
long as they're referring you to an outside source, you don't pay anything.
Well, if you play the VA, a lot of guys, and they get off on the wrong track with that. But if you go through the VA, you got to go through community care, and you got to have it approved through community care.
Right.
And this lady in Dayton, who's the head of vascular surgery, she said, I can do that like now. I don't have to.
That's great.
So that's what happened, and that's why now I'm going to Indianapolis. So
that's great.
And I feel pretty comfortable with that. But when I first started with the VA, I just didn't know whether I wanted to do that, because I had A and B, and then I had, I'm pretty sure the Medicare Advantage. I don't know what happened, but I got rid of the Medicare Advantage. Something happened that triggered that, though. I would not have just automatically got, because my wife has that.
Right.
And she lives and dies by Medicare Advantage.
Well, up to 2 years ago, Medicare Advantage plans for all carriers except Reed Alliance, that Health Alliance group, all the other carriers were never in network for Advantage plans. It just happened 2 years ago.
And she's in that Reed Alliance thing. I'm just sure because what she was talking about, the donut hole and all that, she gets involved. My wife is diabetic. So she takes 3 or 4 insulins a day. So that's been a good program, a good solid program.
Well, and so go ahead, Ron.
No, I was just saying, my concern is I get emails, phone calls, you name it, and they're telling me, with Medicare, you can get $1,500 a month for groceries, and you can get this and that and the other, and I'm afraid to mess with any of that stuff,
So you bring that up. So let me explain that a little bit, okay? So I'm going to back up just a second. So Medicare supplements, okay? We're going to go back to the Medicare supplement side.
Okay.
If you have a health insurance license today, you could sell a supplement next week, okay? It's a bottom line, all right? A supplement, it's, Plan F, Plan G. It pays the gaps for A and B, okay? Still doesn't come with dental, vision, hearing, or prescription. But all those plans are identical throughout the country. The only difference is price. It doesn't matter what insurance company, those plans are absolutely identical, okay? On the Advantage side, they could differ by county or zip code.
Whoa.
Okay? Usually, like in Indiana, northern Indiana, central Indiana, southern Indiana, that's how Advantage plans are split up. Okay? Ohio is all over the place because there's about 5 major cities over there. And so, why someone might not have what their friend has, it's because it depends on the county.
It's based on the economy of that region? Or?
That's exactly what it is. And the insurance companies, I don't know why it's designed that way, but that's the reality. But the bottom line is that, those plans, when you move someplace, say someone was in California and moved to Richmond, they would have to change that plan to a Richmond plan.
Man.
Okay.
And it could be more or less coverage.
What's your opinion of the Alliance versus Reed Alliance that they have?
I think that's the same.
It's the same thing. So if you're on a Medicare Advantage program, you're in essence on Reed Alliance program.
Yeah, I mean, if you're an Advantage plan, there's Advantage plans are with in Indiana. You have, of course, the Reed Alliance, but you also have, Humana, United Healthcare, the Anthem, Aetna's, WellCares, stuff like that. So that's what opened up a couple years ago, and competition's, good.
Yeah.
But it depends on the person, because all these plans have little different benefits to them. It depends on the person. That's why, say I sit down with you and your wife, you could have 2 completely different plans. It depends on the medications, depends on the doctors, the specialist. Everything's different with each individual. There's no family plan out there. And there's no HR to call once you retire. Okay?
Tell me about it.
So
I wish there was.
I know, man.
So for our listening audience, which is primarily veterans.
Sure.
But I'm sure that a lot of veterans' wives are watching the program also.
Right. Yeah.
So they want to know also. So what is the best, if you're a veteran, and let's say I just got out of the service and I've got but I'm 65. That seems to, because a lot of our audience, that's what they are. What should we do then? What should a veteran do? If he's 65, should he go to Medicare Advantage program as well as the VA for a backup, or one versus the other? Or
I mean, my take on it is, I'm going to be 56 this year, and I've never even been to the VA. I've never been accepted in there. Okay, so it's not for everybody. Some people like myself can't get in.
Yeah, I went a long time before I could get in.
So, but as far as the Medicare side, the Medicare Advantage side, you have to talk to somebody. The first question I would ask the agent that you're talking to is, do you have the government certification? Can you actually enroll me? Now you could be helped, okay, but do you really know what you're doing?
Right.
If you don't take that yearly government certification and recert, you can't do an Advantage plan or a prescription plan. And so you have to know that. And I'm going to tell you why this is also important here. There's a lot of veterans out there that are under 65. Okay, I'm going to explain kind of in a big overview of the buckets of people, the categories that we're looking at. Okay, that a Medicare Advantage plan is there for. Depends on the situation. Okay, one is veterans that we just saw. Okay, now what's the qualifying factor to have an Advantage plan? It's having A and B. That red, white, and blue card.
Yeah, okay.
Okay, so I'm going to give you an instance. What happens is a veteran gets out, like I did after 6 years, and is disabled. Okay? Once somebody's been disabled for 24 months, they're automatically issued, once they get SSDI, Social Security Disability, they're automatically issued a red, white, and blue card. At that point in time, it makes no difference if they're 25 or 65. They're eligible for Advantage plan. Okay? And literally nobody knows that.
No.
And we're even talking kids that were born with a disability.
Wow.
Okay? Once they reach about 20 and they're in the system, they automatically get issued. So you have veterans, you have people that just retire at 65, you have folks that are on Medicaid and Medicare. That's another category with different plans. Okay, and we have to go through an eligibility verification and all kinds of stuff, but there's a lot to it, and it's per individual, and there's it's hard to find out on your own.
We better start shutting it down.
We got 2 minutes, and he's still got a lot of stuff. I'm telling you, and so we'll have to have you back.
Yeah, I've already learned a little bit this morning.
Really.
Have another session here.
So Brian, so how can folks get a hold of you if they have questions and?
Sure. They can contact me. The phone number that's below there, that's my cell number. And so you can call or text me and ask me any questions you want. I'm here to help. Just try to make some sense out of the Medicare maze is what I call it. But no, I think it's for insurance has given me that sense of purpose that you have while you're in the service and when you're on the fire department.
Right.
It really has given me a sense of purpose. So
well,
he will respond.
That's for our listening audience, for our people who are out there listening, we need to contact him, but veterans, and see where they stack up with all that stuff. I thought I knew everything about insurance, but I've learned a lot this morning.
Okay. Well, folks, we got to go.
Thank you.
Unfortunately, we've run out of time, but we'll have Brian back again. And I enjoyed this.
I did too.
This was great this morning. All right. So we want to thank you. Thank you for watching Proudly We Serve.
Thank you much.
Yep. Thank you.
See you next time around.
Cronin Toyota and Cronin Nissan are honored to partner with Proudly We Served, as well as the continued support of our local active and retired military veterans across eastern Indiana.